Hello viewers, good day to you wherever you're listening to me. Welcome to Excel Health Arena, and we have been on family planning methods or contraceptive methods for some time now, and this time around we have been on hormonal methods of contraception, and we've talked about oral pills, we've talked about injectables, and basically there are some other things that still need to be said on oral pills. I've told us there are mini pills, there are progesterone pills, or only pills. So now the progesterone only pills, it has 21 tablets, then 7 iron tablets, making 28 tablets. I don't want to go into details of that. I've said that in my previous video. And I also talked about mini pills, okay? And I said that I talked about the side effects. Some of the side effects is that it can make you to feel sick, nausea, vomiting. It could make you to add weight because it causes the body to retain fluids. So when there is fluid retention in the body, generally, you increase in weight. It may not necessarily mean that you are going to add fat or accumulate fat like that. It is majorly fluid retention, okay? So it can cause some abdominal, discomfort like that. It could cause some abdominal upset. It could also give you some headaches. Yes, you could have headaches. You could you may just feel sick somehow. You don't, in fact, if you happen to be the type that usually falls sick or feels sick when you are pregnant, maybe one of the things that even suggests to you that you are pregnant is that it makes you feel sick, then you are likely to feel sick when you take oral contraceptive pills, okay? So you feel tired somehow. So let's take note of all these ones. Then the once a month pill. Once a month pill is a long-acting pill. So you take it just once in a month, and it's a combination of long-acting estrogen and short-acting progesterone. And though it is not very, very effective because there are some factors that come in, because it is a long-acting thing, you know what we say when we say something is long-acting? Yes, it takes, let's say it takes a period of 28 days for it to be effective, to work effectively. Now, there are factors that could come in the process of the 28 days that will reduce the efficacy and efficiency or effectiveness of this kind of drug. So when such factors come in, there is tendency to reduce the effectiveness or the potency of the drug. And as a result of that, effectiveness would not be so guaranteed or assured. So for that reason, it is important for us to take note that when we are taking long-acting or once a month pill, we must have it at the back of our minds that it is not so effective. There is high rate of pregnancy that happens in the process, and there could be irregular menstrual flow or menstrual cycle. Irregular menstrual cycle rather. Now, a quick one, I need to let us know that there are drugs that interact or reduce the efficacy of hormonal contraceptives. There are other drugs that are not contraceptives. Usually on day-to-day activities, we may have cause to take some other drugs. So when a woman goes to the hospital for any consultation, that is why it is not even the best thing. It is not the best practice for you to just think of, oh, orin formiloni, jẹ́ kí n lọ sọ́dọ̀ chemist kí n sáré lọ ra oògùn. Don't do me, jẹ́ kí n lọ sọ́dọ̀ chemist kí n lọ ra oògùn. Because when you do this thing, you never can tell those drugs that would alter the effectiveness of some other drugs that you have taken or you are taking. So that is why it is important for you not to just self-medicate. Don't just say that, okay, I've taken this drug before. When I felt this way, this was the particular drug they prescribed for me, so I can go ahead and take the drug again. No, it's very, very dangerous, and it's very, it's dangerous, and sometimes it can even cause a lot of problems, apart from the fact that it can make some other drugs not to work again or work effectively. So let us take note of that, so that whenever we have cause to take drugs, we consider those ones that we are taking on regular basis, so that they don't affect each other, either make things worse for us or make the drug not to work. So let's take note of that. I've said it, effectiveness wise, there is high rate of pregnancy and irregular menstrual cycle. For your information, or let me say, to reiterate what I've said before, male pills also are available. Male pills, males are able to, take pills just like women take pills to prevent pregnancy. How do they do it? They take the pills, and the pills, what the pills do is that they produce what we call oligospermia, reduced sperm count. So if a man does not want to impregnate a woman, he can take the oral pills to reduce the sperm count, one, and to also reduce the sperm strength and agility. So azoospermia too would occur. It will weaken even the reduced quantity or number of sperm that is eventually produced. It will reduce their strength, their agility, and they will not be able to struggle to find their way, up into the uterus, then to the fallopian tubes to fertilize an egg. So when the sperm is much reduced, then those ones that are even produced, they don't have enough strength to fertilize. So at the end of the day, pregnancy does not happen. And 10% of men, after about 6 months, become eventually azoospermic. That is, their sperm is permanently weakened. That is a side effect that we should take note of. Don't forget, I said in about 10% of men. So that is about in 1 out of 10 men. 1 out of 10 men would experience that. It will weaken their sperm permanently. Even if they want a strong sperm, at the end of the day, they may not be able to get it. So let's take note of that. It's important. So advantages of oral pills. Yes, definitely it prevents pregnancy. It also regulates menstrual period. I've said it. It makes menstrual cramp easy. You see, it eases a lot of menstrual cramps. There are lots of women that experience menstrual cramps. Pain. In fact, sometimes menstrual cramps for some people can be so, intense that it cripples a lot of things for them. Sometimes they find it difficult to go to work, especially the first and second day. First thing that they are just expecting menstrual flow. Some people 24, 48 hours before the menstrual flow begins, they start to feel these cramps, serious ones, to the extent that they may not even be able to go out. Even when they take drugs, it may not, give them a form of relief that is enough for them to be able to pull through the stress or other things for the day like that without too much stress. So oral pills do this. They prevent or minimize to the barest minimum menstrual cramps, and they also reduce the incidence of ovarian and uterine cancer. Even though cancer is a contraindication to these drugs, if there is an already existing cancer, it is advisable that you do not take these drugs. But you also need to know that if there is no cancer in place, these drugs are also good in preventing or reducing the rate of possibilities of cancer. Okay, and acne is a form of skin disease, usually among baby boya ifo or something. We call it ifo. Yes. So when we take oral pills, it prevents the occurrence of such things, and it also provides protection against about at least 6 diseases. benign breast disorder, it prevents benign breast disorder, ovarian cyst, iron deficiency anemia, because you will still be able to replace the iron and the blood that you have lost. Pelvic inflammatory disease, it also prevents that. Ectopic pregnancy, ovarian cancer, all those, it prevents them.